All right, we're live. Okay, so let me quickly make some introductions. All right, good evening, ladies and gentlemen, to this edition of BioTalk. This evening we are having Mrs. Dada, who will be taking us on the topic about medical lab analysis and their importance in Nigeria. Recently, we heard about the importance of testing, especially during this COVID era, and one or two of our speakers have spoken about the need for laboratory analysis, especially in the diagnosis of diseases, infectious and even non-infectious. But this evening we'll be looking at the ones that deal with infectious diseases. So she will be putting us through. Her profile has been on our pages, different pages for about some few days now. She's the no, don't let me do the introduction. I think she will be the one to say that, but she's a medical lab scientist and she's the assistant chief medical laboratory scientist in the Lagos State Health Service Commission. So I'm going to stop talking now, and I'm going to hand over to her so that she can do justice to the topic of the role of medical laboratory analysis in the diagnosis of infectious diseases. You're welcome, ma'am.
Thank you very much, Doctor. Good evening. Dr. Fashion for the privilege to be here. My name is Dada, medical laboratory scientist. I have specialized in hematology and blood transfusion, and I have a fellows in microbiology. So this evening we'll be discussing on the role of medical laboratory analysis in the diagnosis of infectious diseases. I hope you have a good time on the topic with me. Okay, so we have caution highlights. We'll talk about what infectious diseases are, the types of infectious diseases that we have, particularly the common ones that you and I know. Then we'll talk about the causative agents. What do I mean by that? I mean the organisms that are responsible for the different types of common infectious diseases that we have. Now, we'll now go into the role of medical laboratory in the diagnosis of infectious diseases. Okay. So what are infectious diseases? Infectious diseases are diseases that are caused by microorganisms. Microorganisms, I mean organisms that you and I can't see with our naked eyes. They are called microorganisms because they are very minute in size, and it takes a special kind of equipment for you to be able to see those organisms. And we have different types of infectious diseases and different causative organisms. Structures in Nigeria have shown that infectious diseases such as tuberculosis, HIV/AIDS, diarrhea, we have meningitis, and malaria account for approximately 25% of deaths in the country, while respiratory infections such as, there is a surge now all over the world. There is a pandemic caused by a very deadly virus. It's a respiratory infection. So that and some other types of infections that are respiratory alone account for 7% of deaths. Now, we have different types of organisms that causes infections. We have bacteria. There are different types of bacteria. There are different classifications of bacteria. We have the viruses. They also have different types and different classifications. We have parasites, different types as well. Commonly, the protozoans that causes the common parasitic infection that we know, malaria infection. And then we have fungi. Those are different types of organisms that could cause infectious diseases in the body. So we have infections that could be bacteria, types of organisms, microorganisms that are responsible for infectious diseases. I say we have the bacteria, we have viruses, we have protozoans, the parasites, and we have the fungi. Now, some examples of infections that are caused by bacteria include tuberculosis, cholera, dysentery. We have some examples of other infections that are caused by viruses, such as human immunodeficiency virus, HIV, that is known. We have hepatitis. There are different types of hepatitis. We have hepatitis B. We have hepatitis C. There is also hepatitis A. There is also hepatitis E. The hepatitis B and C, the surface antigen, hepatitis B is known as hepatitis B surface antigen, and the hepatitis C is, the infective agent is a core antigen. So the common hepatitis that we all know is the hepatitis B and C, and we have ones that are not really known, the A and E. Then amongst those that are caused by viruses, the one that is still ravaging the world now, the COVID-19. Then we have infections that are caused by parasites. Malaria is a common example. The fight against malaria has been so tough, but is still ravaging the world, particularly the tropics. So malaria is caused by protozoans, and then we have infections caused by fungi. Okay, having said that, I will say that a lot goes into the management of infectious diseases. From the laboratory perspective that I'm to talk about, the laboratory plays a vital role in diagnosis, management of diseases as a whole, not only infectious diseases. There are different kinds of diseases. Now, the laboratory is like a pathfinder, if I could use the word. When presentations are made to the clinicians about diseases, the laboratory has a role to investigate. What do I mean? There are body fluids, blood, urine, stool, sputum, different kinds of, cerebrospinal fluid, feces. They are, we call it specimen. So when a presentation is made to a clinician, it is the role of the laboratory to find out the cause of infections. So the laboratory has different roles to play in management of diseases. There is the diagnostic role. What do I mean by that? There is the role of analysis, taking samples from patients' body fluids particularly, waste products from the body, to run analysis on those samples to find out the cause of infection, which will be useful for the clinicians to either establish diagnosis or to confirm diagnosis. Let me explain what I mean by that. When a patient presents to a clinician with symptoms, sometimes the clinicians will have idea of, okay, this is what could be responsible for the symptoms that the patient is having. But he still has to confirm his suspicions, and it is the laboratory that does the confirmation. So investigations will be done to know what is actually causing the ailment. And then when results are out, the clinician can now confirm his suspicion, or you'll be able to establish diagnosis based on the outcome of the results. So a lot goes into management of infectious diseases. And let me chip in that there are so many factors that comes into play in medical laboratory science, because there are different sections in medical laboratory. We have the hematology, those that deals with investigations of ailments in the blood. We have chemical pathology that deals with the chemical science of body fluids, biochemical science of body fluids. Then we have bacteriology that deals with study of bacteria, biological bacteria, bacteria that affect humans. And then we have parasitology that deals with the study of parasites, human parasites, so to say. We also have virology, study of viruses, human viruses. We also have blood transfusion science that deals with investigations of the science of transfusion. And we also have histopathology that deals with study of investigations on cause of death. Let me make it in simple words. So those are the different sections, different specializations in medical laboratory science that we have. So having said that, the role of the laboratory is multifaceted in diagnosis, because depending on the presentation of infectious diseases now, that is what will determine the kind of laboratory testing that will be done. And there is a saying in medical laboratory science that the quality of your results depends on the quality of your samples. So Sampling must be properly done. Specimen sampling must be done properly because there are standards that must be met. There are national standards, there are international standards, there are national and international guidelines that have standards that must be met in specimen collection, specimen transport, storage, and the analytical procedures. So relating this to management, the role of the laboratory in the management of infectious diseases, the testing of specimen from body fluids to establish diagnoses must follow international standards. So there are, like I said earlier, the role of the laboratory is one, diagnostic, that deals with investigations of the cause of an ailment. This is done by the collection of the respective sample from the body for testing. So the kind of sample that will be collected for investigation of a particular disease depends on the type of the ailment. Essentially, you can use blood if you are looking for parasites like malaria. You can use urine if you are looking for parasites like schistosoma. You can use stool if you are looking for parasites like cholera. You can use sputum if you are looking for parasites like tuberculosis. So the kind of disease that is at hand determines the kind of sample that will be taken and dictates the kind of analysis that will be done. But regardless, there is a general rule when it comes to testing. The specimen must be collected appropriately. Precautions prior to specimen collection, depending on the kind of investigation to be done, those precautions must be met. Then, the right personnel who has knowledge of the collection and the handling of the sample must be involved in the sample collection. The sample collected must be transported appropriately because there are some samples that needed to be transported. So the right transport medium must be used, and peradventure, the sample has to be stored. It has to be stored at the right, under the right condition. So the role of the laboratory is diagnostic, like I said, digging deep into the cause of ailments, establishing diagnoses that serves as a guide to the clinicians in the treatment of diseases. The laboratory also has, aside from the diagnostic role, the surveillance role. What do I mean by that? When there is an outbreak of diseases, a good example is the COVID-19 that is a pandemic now. The laboratory does the testing. The laboratory generates data from the testing. Now, that data that is generated in the laboratory can be used for surveillance. That is, the data generated, the data collected can be analyzed and interpreted. All these data, they are essential for planning, implementation, and evaluation of outbreaks of diseases. If you follow closely, when the outbreak of COVID started, the National Center for Disease Control was giving daily statistics of the positives, the death. It is the laboratory that does the testing, and it is from the laboratory that the data that was posted by the NDC was collected. So the laboratory has a surveillance role in the management of infectious diseases. And the data generated is useful for epidemiological studies. What do I mean? The data can be used to project preventive measures. The data can be used also to draw funds from NGOs to manage the outbreak. So part of the role of the laboratory is in surveillance. Now, let's talk about factors that affect patients having access to getting quality. I put the word quality. It's not enough to have a test done in the laboratory. The testing has to be done following approved standards. The country has its own national guidelines for testing, and there is an international standard. In medical laboratory, we call it the ISO 15189 that has 12 essentials, and it's a guide to, it covers the whole section of laboratory testing from the pre-analytical to the analytical to the post-analytical. And there are policies, there are procedures that must be met for a result to be acceptable. So laboratory testing must be quality. That's why it puts the word factors affecting patients' access to getting quality, available, accurate medical analysis in Nigeria, and how to mitigate it. There are a lot of factors that affect patients' access to getting quality and available and accurate medical analysis in Nigeria. The first thing is distribution of medical facilities. You know, we have urban areas, we have rural areas. And then you and I know that Nigeria has a very huge population. I can relate Lagos as an example. It's ideal that medical facilities should be accessible to the populace. In the rural areas is an exemption. If you go to some rural areas, the kind of facilities that you see, fine, they provide service, but then are those services of quality, acceptable standards? That's the question. Even in the rural areas, there are a lot of facilities everywhere. How many of them have standards? That's a huge challenge. Every corner in Lagos where I stay, you'll find medical laboratories. You'll find hospitals, medical facilities. And then people go in there for analysis, have testing done. And the question is, are those facilities standard? Are those facilities manned by those that have the technical know-how of medical laboratory? That's one. Geographical distribution of health facilities. The government has a huge role to play. Most states in Nigeria have health facilities. And then the question is, are they well equipped to render quality service? Aside from the distribution, are they well equipped to render quality service? It's a question for you and I. Then there has to be affordability to patients. If you go to hospitals and you have a laboratory request, it doesn't come cheap. And the economy is biting hard. So the government has a role to play with that. The government has to come in by subsidizing, particularly the government, government facilities now. The government should come in by subsidizing some of those costs for the patients so that it can be affordable. Most times you'll find patients coming with a request. At the end of the day, they will tell you, can I do 2 out of 3? Because of the cost. So affordability to patients is another factor that is affecting getting available medical analysis. And the plea for, or do I use the word plea? The need for the government to, I don't know if it's possible for us to have a free medical health. It's possible if the government can do it, but some states are actually trying to mitigate that aspect of the factor. Some states have this health insurance in place for their populace, and I can say it's actually mitigating in a way. It's cushioning the effect of costs for patients to have access to medical care. So affordability to clients is another factor, and I think, like I said, the government coming in to subsidize costs for patients, and then health insurance. It will be so good if all the states in Nigeria can actually adopt the health insurance scheme for the citizens in those states. So what else? Factors affecting access. Personnel. Personnel. I'm stressing the word personnel because it's not enough to have a facility. It's essential to have qualified personnel manning those facilities. You need to have knowledge of what you are doing for you to do it right. You need to know that there are standards to be met. A lot of medical facilities need to be accredited. A lot has to go through the accreditation process for some quality to be put into delivery of medical laboratory service. So there is need for facilities to have qualified personnel to run investigations. Another factor that affects patient access is population. What do I mean? I work in a government facility, and you need to visit a government facility on a daily basis to see the number of clients that troop in on a daily basis. Most people will stay back because they don't want to spend a lot of time at the hospital. So they will rather quickly dash into a chemist and just get treatment by the side. So if the government can decentralize facilities by building more health facilities so that the crowding on the existing ones can be reduced, will also cushion the effect of patients having access to laboratory facilities in Nigeria. So if there are questions, contributions, I'll I'll be expecting.
All right, that's actually a very, very straightforward presentation. You actually tackled all the outcomes that we listed out for you. I guess I will be asking some questions because we don't have people who joined us here, but I believe a lot of people are already asking questions on the page, so you'll be answering the questions after the videos have been posted. So I have some questions listed here for you. Thank you for your presentation. It's actually very good, very straightforward, and it's shedding light to a lot of issues that we have. And like I said, the idea is to give the public an idea of what is going on behind the scene. I keep repeating it. One of the reasons why these BioTalks are being set up is because we want to demystify medical sciences, biomedical issues, bioscience, and we don't want people to be looking at it like, okay, it is only you that know what is going on there. As long as people know what is going on, they'll be able to navigate exactly. They may not be able to run the test or do anything, but at least they will know the political and social issues that are connected with it so that they'll be able to. So the first question I have here is concerning when you were talking about sample collection. Sample collectors, those who collect samples, are they, because at least I work in some facilities, but generally, can a sample collector also be the sample analyst? Or there are people who are dedicated to collections? I'll tell you the reason why I'm asking this question. When I was the first experience I had when I was doing my IT, I remember it was inside a medical lab. I work with medical lab, and I realized that there are some people dedicated to collection of samples, like maybe drawing out blood and all those things. And there are some that are also dedicated to the analysis side, and then we have some that do both together. But in an ideal sense, is there a difference, or are there differences there? Let me also add this so that you also get where I'm coming from. In a lab at UCH, when I was in UCH, most people at the sample collection side, whenever they come for HIV and hepatitis B tests, they are also saddled with what they call it, counseling. They maybe, yeah, whatever they come around, they'll be the one to provide the information, and okay, this is what, if you have this is what you do. So what's the work of a sample collector? Is it different from that of an analyst? I need to shed more light on that one.
Okay, thank you very much, Doctor. I heard that medical laboratory science has sections. I do practice. I keep stressing the word I do practice, and that practice dictates that. See, a lot goes into sample collection. It's a whole, it's on its own, because there are criteria to be met with collection, handling patients, documenting. That was when I was talking about the role of the laboratory. I said the quality of sampling determines the quality of the results. So sample collection is analysis. So there are people that has the technical expertise that is involved in sample collection. They know how to handle each request as it comes, how to document properly. They are called phlebotomists. It is a part of medical laboratory science. They are trained in specimen collection. They know the procedures involved in each state as specimen collection is involved, right from identifying patients, because you have to be sure of who you are dealing with. Patient identification is the first thing. The patient has to be rightly identified. The testing has to be properly, there are some tests that has precautions that must be met before the sample can be collected. So those that are at the sample collection point, they know all that detail that each kind of request involves. And then they know the kind of timing, because some tests are time dependent. They know the kind of specimen bottle, and then documentation has to be properly done. So there is a kind of quality that, I do practice those that collect samples to reverse collection, those that will handle samples to handle samples. And you mentioned counseling when it involves HIV, the expertise is involved as well. You have to prepare your patient. You have to work on their psyche before you take their sample, so that you can maintain their emotions when the result comes out. I hope I answered the question, right?
Yes, you did, man. That's actually because I think that clears a lot of issues, because I think the sample collectors are actually very important as well, because I during the outbreak of COVID-19, when we're in the front, that's actually a good, that explains a lot. So I also have a question here. You mentioned something about surveillance.
Yeah.
And I want to ask that, do you people work closely with, okay, let's say for instance, now during this epidemic period, during this pandemic period, which is also an epidemic, you work closely with field epidemiologists in this area, because when you mention data, I believe that the data goes back to some people who are going to interpret and use it to maybe plan their, or it can medical lab scientists be part of the, can they work also as epidemiologists in the sense of the word, or the work is a little bit streamlined into generating of data and doing the analysis? Because I remember you specifically mentioned that. So can you work as a field epidemiologist as well, or you work with them?
Medical practice is teamwork.
Yes.
Teamwork. So it goes hand in hand. But you find some medical laboratory scientists that are actively involved in field work as field epidemiologists. It's a teamwork, essentially.
It's a teamwork. All right.
It's a teamwork.
All right.
It starts with the other facets.
Okay. All right. That's good. So you guys go. You guys have a team. Okay, let's say there's a surveillance team now in Lagos State. That surveillance team will definitely have medical laboratory scientists as part of the members. Oh, okay. All right, man. All right. Okay, I have another question here concerning health insurance. You mentioned health insurance, and I want to, this is actually a very direct question. Does health insurance also cover medical tests?
Yes, though it's limited. It's limited in the sense that there are selected investigations that it covers. But
Okay.
there are selected investigations, but at least, it mitigates cost on the part of patients, makes it a bit affordable for the patient.
Okay.
It's in a way. It doesn't cover, laboratory testing has, how do I say it? There are simple tests, there are comprehensive tests.
Okay.
Health insurance covers those simple tests that at least patients can have access to. And then
Can you
going
please
further.
mention those simple? Okay. So before I ask that question, uh, insurance, health insurance, that it varies from, should I say, maybe from places to places. I think the national one is NHIS, right?
Yeah.
Do each does each state in the country, let's say Lagos State for instance, do they have their own health insurance scheme that is different from NHIS?
Yes, Lagos State has its own.
Oh, they have, okay. Okay, then we now have the private health insurance schemes as well.
That's why I'm
Okay.
canvassing that other states should follow
Other
suit, so
states
it
should.
makes life
Okay.
exactly.
Okay. Do you have any idea about the medical tests that Lagos State Insurance covers for at least the simple ones? So that, yes, it's part of a way of, let me be honest with you, people are scared about the cost of medical tests. Yes. A friend of mine runs an hospital here in Ekiti.
Quality is not cheap.
Yes, quality is not cheap, but you just mentioned that the simple ones are still covered.
Yeah, affordable.
Yeah, they are affordable. So, if of course insurance is not cheap anyway. We still pay some money, at least some, what they call it, premiums, so that, yeah. What do you say?
I said
I can't hear you.
affordability is the key.
Yes,
I
yes,
said
yes. That's it.
affordability. Exactly. Basic
All right.
basic testing.
You are not giving me examples. I was thinking about examples so that I'll be able to tell my friends so they should go and do health insurance. So.
Lagos State employee, I'm limited,
Okay. Okay. So maybe the question will, maybe if I get hold of the one heading Lagos State health insurance scheme, I'll be able to ask him or her that question. It's a way of marketing this thing so that when people go, when they have that information, they will know that, oh, okay, if I have no, anyway, I'll do it this way. You help us find out the ones that we public need to know, and maybe we get to post it as a comment under this post.
The state government the publicity is there already. Huge publicity
Oh,
is there for the public.
okay, okay. I will try and get access to that information. Okay. So okay, I still have two more questions before I let you go. Um, when you were mentioning
Yes.
personnel, a particular question comes to my mind, and it's it confuses some of us in the non-laboratory section to a certain extent. What what are the differences between technologists and technicians? Sometimes
Okay.
we believe
Good
that
question.
so that we won't when they say somebody is a technician, we are like, oh, okay, how can this person run this analysis, or can we approach blah blah blah? So what are the basic differences between them, and what are their functions?
Okay. I have a correction to the statement first.
Okay, ma'am.
The medical laboratory science has two figures. There is
Okay.
technician, and then the word technology is obsolete.
Oh,
It's no longer, it is now medical laboratory.
science. Okay, scientist. Okay.
We have a council in Nigeria, Medical Laboratory Science Council, that oversees medical laboratory technicians and medical laboratory scientists.
All right. All right. Okay. Let me note that.
Okay. Now, the medical laboratory technicians is still medical laboratory personnel qualified to work in the laboratory, but they are not involved in the technicality of
Okay. Technicality of the test.
exactly. The medical laboratory science are knowledgeable in analysis.
Okay.
The laboratory technicians are those that most times you find handling specimen collection.
Okay.
Okay. They are also medical laboratory personnel, but then, the depth of curriculum,
All right.
the depth of curriculum of study differs. Medical laboratory science has a comprehensive curriculum that covers all the phases of analysis from the pre to the post. But the curriculum for the medical laboratory technicians is limited.
Oh,
But
okay. They are both products of the same, or they
council,
have product of the, okay, they get registered under the
we
same
have the same,
council.
yes, the same, one regulatory body controls the two professions.
Okay, man. From the same institutions. The reason why I'm asking this is that I have some of my, should I call them younger ones, who graduated from what they call this institution, Earth Technologies, Earth Tech. Yeah.
Yes,
So most of the time, by the time I ask them a question, they said they are more like laboratory technicians. So
yeah, they
I,
are laboratory.
oh, okay. So that they will be able to know. Oh,
They are
okay.
laboratory technicians.
All right, ma. Okay, but the microphone is not actually working perfectly from your side. Maybe it's the network anyway. Yeah. Okay, so I'm able to get that now. They can also work in the laboratories, uh, and they
They are
can
qualified.
definitely they are qualified to work in the laboratory. All right, man. Okay, so the last question I have here, this might be a suggestion, but it's probably will be ratified by you. Maybe it might not actually be a very correct suggestion anyway. When you were saying that we have we don't have facilities like that can cater for the uh, should I call it the crowd, the client that comes to the medical lab sections every day. And you said they are going to eventually, some of them will just decided that after seeing those crowd, they don't want to join the queue. They go to the pharmacy to get drugs. I know this might actually be
Because
bordering. Yeah, this might actually be bordering on professional. Should I call it professional associations issues with professionalization? Is it possible for pharmacists to be involved in this deregulation of medical laboratories. Most of these big pharmacy have sections where pharmacists attend to patients. We recognize that. Is it possible for some of them to set up maybe under, should I call it under regulation by your association, where they can also run tests for patients, or it has to be a full medical facilities? It's a suggestion, like an idea just popped into my mind, that how possible is that? So that the crowd, the management, we have a lot of deregulations.
For as long as what you mean is a pharmacist that has a pharmacy.
Yes.
Having a medical laboratory by the side.
Yes. Being run by a qualified personnel.
A qualified medical laboratory scientist.
Yes.
Why not? If he has the money, he's good to go. What matters is it has to be run by a qualified personnel and registered appropriately. You know, as a pharmacist, when you have a pharmacy, you register with the pharmaceutical association.
Yes.
So if you're having a laboratory, you need to employ a medical laboratory scientist who will work in the laboratory, and you have to register the laboratory with the council separately.
Oh, separately. Okay.
Because they are different professions run by different regulatory bodies, handled by different professionals. So it's not for a pharmacist to be doing tests or laboratory tests.
No. The pharmacy cannot do tests. They don't. I don't think. Yeah. Even some of them cannot. Okay. I get it now. But it can be registered under the same company.
Once it does it right, having the right personnel, registering appropriately, licensed personnel, medical laboratory science.
All right. Okay. Well, that's a good business idea for some of my friends in that has pharmacies. I'll definitely tell them they can do that under their company register, get a lab, get a licensed medical lab scientist, and then it will take away the crowd, because if these people can be recommending drugs, I believe they do. They have pharmacists who recommend drugs or medicine for people, treatment. In fact, some of them even go as far as giving injections and the likes. I think they are permitted to do that under the law. Yes. So if
no coverage of I really don't know what their coverage is with their profession, but for me, if a pharmacist decides to open a medical laboratory, he has to register the laboratory with the council, Medical Laboratory Science Council.
Yes. No, I understand. That's why I'm trying to just strike a business deal in my head. I'm thinking of if they can be recommending drugs and medicine for us, then they should as well get a lab and put the right person there to be running it. So it will. I may test run it later. Okay. Thank you for your time, Ma. This has been very eye-opening, and as we actually even keep to time. It's supposed to be 7 to 8, and I'm actually happy about that. So we'll be hosting you very much later again, because we still have a lot of information that we need to get from you. We believe that you will still answer us whenever we call you. I hope so, Ma. Yeah. So thank you so much, Mrs. Dolapo Dada. You've been a real good educator on this issue of BioTalk, and I hope you join us for next one. So I want to say thank you to everyone. Eventually, we don't have the crowd. We're test running some of these apps. Facebook is giving us a lot of issues, but eventually we get it right. But the video is also has been recorded. It's on Facebook Live, and you'll be able to answer ask your questions under the video if you listen to it, and then you'll be able to also have access to all the questions that I've asked that our invited speaker has provided. So good night, everyone. So thank you once again, Ma. Hope to see you, yeah, very soon again. Thanks so much. Good night, Ma.
Thank you.
Yes, Ma.